Well, a bit of a silver lining in the battle against the coronavirus, death rates are either down or flat in 38 states across the country. But death rates, rather, let me clarify that. Death rates are down or up, yes, but they are up in 12 states. So down in most states or flat, but up in a few. It's still a notable improvement compared to last month when 26 states were seeing increases. So far, more than 176,000 Americans have died, though, from the respiratory disease, and more than 5 million have been infected. So now the FDA is issuing an emergency authorization allowing doctors to use blood plasma from COVID survivors as a treatment for the disease. The move is raising doubts among some experts, including the chief scientists at the World Health Organization, who say the effectiveness of that therapy is not clear. So let's try and clear some things up. We want to talk about the latest medical news and developments and bring in Dr. Ron Elfenbein. Doctor, thank you so much for joining us. So let's just dig into this whole thing about the plasma. In terms of its effectiveness, what do we know so far? How is it being used now?
Well, good morning to both of you. It's good to see you both. So the convalescent plasma, which is what we're talking about, has been used to treat well over 75,000 people already by the Mayo Clinic. And according to the emergency use authorization, which was just released by the FDA, they claim that there's a 35% improvement in survival with using this treatment. Now, the detractors of this are saying that, well, you know, there's not enough data and there's never been a randomized controlled trial done with this, and that is true. But if you sort of use historical norms, we've been using convalescent plasma as a treatment for viral illnesses and other illnesses actually since the 1890s, and it's been very, very effective and worked very, very well. So, you know, it's true that there's never that we have not had a lot of data with a randomized controlled trial, which is the gold standard in science. That's what you want to do, is to have one arm that gets the medicine and one arm that doesn't, and make it completely randomized and blinded, double blinded, which is the best kind of study, so that you don't even know what you're getting, and really to compare them head to head, which one works better. But if you go based on the emergency use authorizations that the FDA has been giving out, they basically, it just means that they're doing the best that they can with the limited data that they have. If you look at the testing that we have, if you look at the treatments that we have for COVID, none of them are FDA approved. Every single thing that we have for COVID-19 is FDA authorized under an emergency use authorization, which is exactly what convalescent plasma just got. So, you know, I understand both sides of the argument here, but if you look at what the FDA has been doing all along, this kind of goes along with what they're doing, which makes sense in a pandemic situation.
So, Dr. Elfenbein, as you know, earlier this month, the New York Times reported that the demand for plasma has undercut research that could prove it actually works. The question I think that would be helpful for you to address to our viewers is, when ordinary people see the back and forth, they hear that the FDA, you know, just a few days ago was not willing to authorize it for emergency use because, as you say, some of the data was limited, even though it has been used effectively and successfully for many, many decades, as you noted. And now all of a sudden we see that the FDA comes out and says, no, we are going to provide this authorization. You know, whether it's political in nature or not, that's how it is perceived by the American public. And so we're in a situation right now where people don't really know who to trust. They don't know there have been so many efforts to hamper the ability of scientists and doctors like yourself to get information out to the American people, that people are just sort of wary on both sides, you know, as to whether or not they should trust information coming out from the federal government. So you know, what is your best take on that? Yes, it's been used effectively, but is this sort of the cure-all that's being touted by some in the administration?
That's a really good question, Vlad. Thank you for asking it. I think it's not a cure-all. And I think anyone who says that is misguided or has ulterior motives. I think it's definitely a quiver or an arrow in the quiver that we can use in the fight against COVID-19. And I think it's got promising. It has a lot of promise to it, but it's not the end all be all, and it's not the sort of magic bullet that everybody's been looking for. If it's true that it does reduce mortality by 35%. Now, that's in a very small selected population. Remember, this isn't for just everybody who gets COVID-19. This is for a small subset of patients who are hospitalized with COVID-19. So if it's true that it does reduce mortality by 35%, fantastic. Then that is a great tool in our arsenal. But it is certainly not 100% effective. Nobody's claiming it's 100% effective. So it's not the end-all, be-all. But it's definitely something that we should be using and that we definitely need more science on. The science, as I said before, is very weak with regards to this. But it has been shown through anecdotal evidence that it works very well. So, and there is some evidence, as I said, that it does work. The Mayo Clinic has come out and said so with their 70,000 plus patients that they've treated. So, you can't always have the gold standard that you want in a situation like we're in. So I think you kind of have to weigh both sides. And yes, I'm sure there's some politics to this as well, which is unfortunate because you should not be politicizing viral illness.
Yeah, we should note that, after the press conference yesterday, several reporters, including our own Paula Reed, tried to ask Dr. Hahn, the head of the FDA, if there was any political pressure. He then released a statement later and said that there has not been any political pressure, but still a lot of people are sort of scratching their heads. He did push back on the president's claim that plasma is, to use the president's term, very effective against COVID-19. Dr. Ron Elfenbein, thank you very much. We appreciate it.
Thank you.